Hey everyone, welcome back to Ask Dr. Slater. In this series, you get to ask me, a board-certified orthopedic specialist with 17 years experience in this field, your healthcare questions. So if you found this helpful, make sure to like and subscribe so you can submit your own questions that we'll be answering each week. Let's get to it. The reason your carpal tunnel symptoms get worse with sleeping is because it's actually coming from your neck. This happens all the time and it gets misdiagnosed. If you want to know more, go to my carpal tunnel playlist series. It's a playlist tab on my TikTok page or on YouTube. It'll take you through what is and isn't carpal tunnel, and better yet, it'll tell you how to actually get relief, how to get treatment. This person writes, how do you foam roll for this? I'm 30 weeks pregnant and I'm feeling that this is not carpal tunnel. It's worse in the morning. Throughout the night, it gets numb and I can't bend my hands or grip for a good hour from waking up. And that's because you put stress through your neck throughout the night. That's the area that's actually causing your symptoms. Carpal tunnel is an irritation of the median nerve. The median nerve starts at your neck and then travels down your arm. It goes through an anatomical site called the carpal tunnel. Compression of the nerve at the carpal tunnel looks almost identical to compression of the nerve at the neck. It is rarely actually carpal tunnel. It is almost always a neck issue. If you had a meniscus repair, you probably didn't have a meniscus repair. So most of the people that get a meniscus repair actually get what's called a meniscectomy. And this is where they go in, they remove and they clean up the torn portion of the meniscus, they cut it out, and that's it. They don't really repair anything. This person writes, is it proper instructions to get rid of crutches 2 weeks after surgery for meniscus tear repair and root repair? So it's impossible to say. It depends on the size of the tear, the location of the tear, but also whether or not you actually had a meniscus repair in the first place. This person saying that they were walking with crutches afterwards probably actually had a repair because you're non-weight bearing for a certain amount of time. Most of the time it's somewhere between 2 to 6 weeks, more commonly 4 to 6 weeks for an actual meniscus repair where you're non-weight bearing. But for most people out there, you're weight bearing right away after your meniscus repair. Why? Because you didn't have a meniscus repair. We just use this terminology and it kind of gets confusing. Is a TENS unit good for a herniated disc? This is a great question. Absolutely not. It will do nothing to help your herniated disc. Now, it will help with pain temporarily. And that temporarily is somewhere around 15 minutes to an hour, depending on how intense and how long you have it on. Now, what does a TENS unit actually do? TENS unit is transcutaneous electrical nerve stimulation. Transcutaneous meaning it goes across the skin. Electrical nerve stimulation. So it stimulates the nerves to basically interfere with your brain's perception of your pain. So you have back pain, we slap some electrodes on you, we give you a current. That current basically interferes with your brain's perception of your problem. But it does nothing to change the underlying problem. Your disc will still be herniated, protruded, degenerative, whatever. Once the TENS unit is done, it will be no different whatsoever, but for a short period of time, you might feel like the pain is lessened or gone. And again, I am not against temporary relief. If you're in pain, anything that you could do to get out of relief, do. But you need to put your time, energy, effort, and money into something that is also going to give you lasting relief by actually treating the underlying cause. And most of the time, the treatments that we get, like a TENS unit, like a hot pack, like massage and cupping and traction and all this stuff, it's just temporary. It just makes you feel good in the moment, and most people don't understand this. And they're listening to the medical professional who's saying that they're treating you. They're not. They're managing you. That's it for this week of Ask Dr. Slater. Make sure to leave your questions in the comments. Make sure to hit like and subscribe so you don't miss this series. Stay tuned next week.